I see a lot of feminism that has taught us to completely overemphasize our own contributions in everything.
Yeah.
Our own suffering and our own contribution, because feminism has taught us that everyone else is always to blame. So that hinders taking accountability, and that we are constantly oppressed. No matter what you do, you can claim oppression. And who's oppressing us? Well, men.
Mm-hmm.
So that has really, we're so hardwired to overemphasize our own contributions and our own suffering, and we're taught that men and women are just the same. So we don't understand anymore how men are affected by their emotions, how men express emotions and what they need to process their emotions. So if they are not crying and expressing all of their worries all the time, that means they're not worrying.
Yeah. Which is so untrue. Like, I know, it's just to even think, like, pause and think, men don't have emotions, or men do not like to talk about their feelings. I mean, that's not what I see at all. Like, if you get them
I think that we are raised with the resentment born by feminism, and we enter our relationships with that resentment towards men in general. We just don't notice it. We don't recognize it. And I think that is why so many relationships fail. It's inevitable, because resentment is the psychological killer.
Yeah, it sure
there's
is.
nothing good. And we resent men, and we are very quick to blame them and find fault in them. And as soon as someone disagrees with us, we call it narcissism. Because if you disregard my feelings, you must be a narcissist.
Mm-hmm.
If you disagree, you must be a narcissist. Because that's what that is. It's not. It's just low agreeableness.
Right.
And striving for status. And it's more likely you than him.
Yeah, that's interesting, the striving for status part, hey? Like, I mean, like, I could see how that would happen, how it would be common then in the workplace. I'll step over you and whatever I can in order to be, in a higher rank.
Dishonesty, disrespectful, discrimination, detached, dismissive. That's it. I'm done. Relationships can be messy. Are you having trouble with your personal or professional relationship? Not to worry. As a relationship therapist and coach for over 25 years, I have a lot to share. And so will my guest experts. Let's get smarter in our business and personal lives so we can be our best selves. Now, let's get on with the show.
Hello, everyone. Welcome back. Today, I'm joined by Hannah Spier. Now, Hannah was just with me recently, 3-4 weeks ago, I think it was, our last conversation. And we didn't even touch, like, we barely got to the surface of what she actually does every day, why she's so passionate and putting out the content that she does. So I want to get into that a little bit more today. And Hannah, like, I mean, I'm drawn to anybody who speaks the truth. And so obviously I was very attracted to your content. You're very honest, and you bring a different perspective on modern day mental health, which I find is becoming more and more unclear in terms of, who is suffering from a clinical diagnosis and who is someone who's just suffering from a personality disorder, really. They're very different. And so I really want to explore some of that with you today, Hannah. So what are you most passionate about nowadays? Like the type of content that you're creating and you want more and more people to be aware of?
Right. I talk a lot about personality disorders. I do. And I try to raise awareness around, specifically around the borderline personality disorder.
Okay.
Because I do think that we all see that those traits are increasing. We see it on campuses. We see it in HR departments. We see it in workplace bullying. We see it. We see a lot of interpersonal warfare that I think we can trace back to these traits increasing.
Okay.
Yes. So that's what I try to raise awareness of, because I don't see a lot of clinicians doing that. It's a lot of, because what that does is that it does put a moral judgment on female behavior, because borderline personality is predominantly a female disorder. It's 75% women. And it is easier for clinicians to sort of funnel those behaviors into other disorders that are more palatable.
Okay,
and that is what we're seeing.
Okay, I want to take some real life examples so people can sort of like get like the foothold on this. But before we do that, give me other examples of personality disorders, like, the cluster. You mainly talk about cluster B, right?
So the personality disorders and the DSM, they are divided into 3 clusters, right? Clusters A, cluster B, and cluster C. And the cluster B, within there, you have borderline, narcissism, histrionicism, and antisocial personality disorder. And those are they are erratic, they're impulsive. And the argument I make is that the borderline is a female version of the antisocial. And the antisocial, they often become criminals. They have a very, very high likelihood of becoming incarcerated because they are outwardly very aggressive. They tend towards violence. But what mainly joins these 4 is very low trait agreeableness.
Okay.
The narcissist is very low in agreeableness. The antisocial male is very low in agreeableness, and so is the borderliner. And but they have varying. They're vary in their neuroticism, and borderline is they are extremely neurotic. So they did a study where they asked clinicians where they would place the borderline personality in terms of neuroticism. They all said 95th percentile. Neurotic.
And just define neurotic. Like, we hear that term being, you're neurotic, but just define neuroticism.
Yes, of course.
Sorry?
That is desensitivity to negative emotion. So in there you have sensitivity to rejection, you have depressed mood, you have anxiety, guilt, and shame. They all cluster in this trait neuroticism. And so you can be impulsive or volatile, or you can withdraw. So there are different facets within the big 5 personality model. The big 5 being neuroticism, openness, conscientiousness, agreeableness, and extroversion. And within those, you have different facets.
Okay.
So within neuroticism, you're mainly talking about withdrawal or volatility, impulsivity. And the borderliners, they have that in excess. But that doesn't mean that everyone who's very neurotic behave in a borderline manner. You need other things as well. If you couple, for example, let's just finish with the clusters. If you couple, for example, very high neuroticism with very high agreeableness, you will go into the cluster C, where you have the anxious and dependent personalities. There you have a lot of women, because women are on average more neurotic than men, also more agreeable than men. But that is a very common. So we also talk about action systems, what drives the behaviors. And so the agreeableness, they have an excessive need for bonding, for pair bonding, for finding love. And so that's why you get, when you have these women who cannot for the life of them stand up for themselves, they cannot say what they want. You have a lot of them in therapy, right? And they're in these relationships where they are just trapped because they cannot say what they want. They're very afraid, they're very neurotic and very agreeable, and they over sacrifice. And what you need to teach them is to be brave enough to say what they want.
Yeah.
The borderliners, they don't have that. They're very low in agreeableness. They are searching for effective dominance. They're searching to control the environment through their rage, through their volatility. And they can only do that because they're so low in agreeableness, because they don't care about the social norms that you and I care about. So they don't have a problem with throwing a major tantrum in the middle of a packed train and throwing things around, because they will ultimately care much less than you about what everyone else thinks. They only care about the outcome, the emotional outcome of the moment, who wins in that fight.
That's really interesting. So, cluster C, it's more like you're dealing, helping these, and I'm just going to say women. We're going to be talking mainly women today, and my audience is mainly women. So, but more like achieving boundaries with people, like cluster C would be, you got to stop bending, or dependent on other people's whims and things like that. And the cluster B sounds a lot like, and I want to get into this a little bit more, but like, it almost seems like it's in line with the cultural shift that we're seeing now too, in terms of, my truth versus like the truth or universal truth, right? Like it's like, I want what I want, and, I'm going to throw a tantrum until people agree with the way I feel, right? Like
exactly. We have a culture of narcissism, and we have to bring narcissism into that, because that is also a part of the cluster B, the narcissism. And I just did an episode of that, because I don't think we can really successfully separate the borderline from the narcissist. It's very difficult. They all have these narcissistic traits, because what is really narcissism? That is very low agreeableness. It's this delusional belief that you're so special. It's just that you have no problem putting yourself first and being competitive, because you're so low in this affiliation system. You don't really think so communal, so cooperative. As someone who's very agreeable, think cooperatively. Right? What is best for the group? If you're low in agreeableness, you don't really care about that. You have no problem competing. You're competing for status. So narcissism is that drive towards status as easy as possible. And me first and forward. And we've been training young people to think like that since, I'm going to say the 90s, probably before, when we started the self-esteem movement with Montano Brandon. Yeah. We started teaching kids to think about themselves and assert themselves, and asserting themselves. Assertion is within this extroversion, which also narcissists are very high in. They're very high in extroversion, and so they have no problem standing up for themselves. And so we've really been, and these traits in humans can be upregulated, right? Traits can be fostered and encouraged.
Oh, for sure.
So when we're telling people that, like, we're feeding people this constant sense of they're in danger, everything is so acute with your phone, everyone's on their phone, everything has to happen now, you have to satisfy your whims now. And then you're telling them that they shouldn't sacrifice, and self-sacrifice is actually something that an oppressive society will have you do. And what's important is your truth, and your truth is really just your opinion, right? It's just, so this self-esteem movement, I think, did a lot to encourage those traits. And then this is very heritable. We have to bring that in. This is all the data we have points to this being very heritable. So we not only pass that on, we also model it for our kids.
Yeah, exactly.
Yeah.
That's a
So
scary
it's a
part.
double whammy.
Yeah.
Yeah. And
Yeah.
then they get in school. I mean, they're still putting post-its on kids' lockers. You're amazing. You're great. Think about what's best for you. Prioritize your needs.
Yeah. Yeah.
Yeah.
Absolutely. I know, like I often think about the 90s and or early, 2000s, like that whole movement of you get a purple ribbon just because you participated today. Like when we were telling our kids that, like I remember that, like when my kids were small, it's sort of we're kind of wondering, why are all these ribbons being handed out or trophies to every player? And the coaches are like, well, I mean, they participated. And everybody, gets rewarded for
Right.
it's instead of having like these levels of yeah expertise or yeah, no, you're not very good at this, actually. It's sort of like, again, it's being it's showing, it's displaying reality, like you're not as good as a player as your peer, and therefore you don't, it's not just because you want it doesn't mean you get a trophy. And yeah, like I remember that shift. It's like, what was going on? But
Mhm.
anyway, I just want to ask quickly, cluster A then. Can you just briefly mention
Right.
what?
The cluster A, they're the ones who live alone in the woods. Right?
Oh,
It's a schizoid. The schizoid, that's very different.
okay,
Cluster
okay.
A
Oh,
is
yeah,
it's very
that's
different. They're
yeah,
they're the schizoid and
yeah.
the paranoid thinkers, the eccentric, that's very the commonality there is eccentricity. So they're
Okay,
sort of easy to separate.
right, right.
Right.
And
Yeah.
and then ODD, like oppositional defiant disorder, does is
Well, that's something else.
yeah, yeah, it
That's
is.
for
But
kids.
it
Yeah.
kind of reminded me on this lack of agreeableness. Like it's sort of, but I think that's something more that you might see in children, rather
I
than
think that's specifically for children,
yeah.
if that really is a disorder at all.
Mm,
Right. I think
hmm.
that's a topic for another time, but that I
Yeah.
would lump in with, ADHD and not, giving kids the boundaries that they need, taking away the fathers. And so when they realized, just on a tangent, when they realized that they were over diagnosing the ADHD, and that they've done a lot of shifts over the years regarding ADHD. And you had this the bipolar child was suddenly a thing, and they tried to walk some of that back. And then there was a whole host of other sort of letter disorders that popped
Mm,
up to redirect a little bit from the damage that was done. So
mm-hmm.
that's why I wouldn't discuss ODD in the same breath as personality disorders. And
Okay.
so personality disorders take a while. You have that genetic predisposition, you
Yeah.
have the trait constellation, and then you also need the environment.
Mm,
You need to
mm,
have a very specific environment. And then there's a study showing that you'll already see these traits evolving at age of 12, 13. You can already spot some of them.
okay. Okay. That's
And then
yeah.
if they are reinforced and
Mm,
encouraged, you get to a place where the person cannot function in any area of their lives. And that's when you can clinically say this is a disorder, that you have to be able to prove a lack of functional impairment. They can't keep a job, they can't keep a relationship, they have trouble in every area of their life. So
but
that's when you could put that diagnosis.
see, and that just makes it like it's it just reiterates how important it is to see the proper professional, because my worry is that someone, yeah, like 11 or 12-year-old or 13-year-old is going to seek therapy, and they're going to be maybe, put across from someone who has a bachelor's degree, like these EAP programs. Well, obviously a child's not going to access an EAP program, but even like someone with, a bachelor's or like a counselor or a master's, for example, that might, just sit across from this 13-year-old and say, I can imagine how hard this is, rather than and like what I'm saying, like let's say, their parents are sort of forming them in this way, like you say, it environments is going to make a difference here for these kids, rather than maybe referring them on to a clinical psychologist or psychiatrist that can accurately diagnose somebody with these, like the younger, that are starting to develop these traits. I just want to bring that in there because like there's something happening in Canada now, where in the province of Ontario, where they're reducing the supervised clinical training from about 4 years to 1 year. They're allowing master level practitioners to use the title psychologist. They're removing certain like competency exams. So, and they're saying that all of this is to shift towards increasing access of care because of the the weight of mental health. Like that people aren't able to access, those that need it, because of the numbers that we're dealing with. But it's sort of like, to me, I mean, like, do you feel psychology and psychiatry is sort of being like influenced by the broader cultural move to, like, around subjectivity? Like, I'm kind of thinking, is it the chicken and the egg? Was it the psychiatry and psychology, medical and science departments, arts departments, sort of shifting this and changing the culture, or the culture sort of, changing?
Yeah, I think that was a big move, in the 70s, that they, in all the fields, they started moving away from this concept of objective truth. Psychology suffered a lot from that. But what I mean, honestly, the ones who are responsible for diluting the diagnostic manual the way that it has been, they have all been extremely competent, and if you want to call it that, have credentials up the wazoo. They've all been psychiatrists and psychologists, and so I don't think that really credentialing is what's going to turn this ship around at all. I think the bigger problem, one problem, is the feminization, where you have at least 85% of all therapists are female. And we have, there are no incentives for saying no. A patient comes in, what incentive do you have to gatekeep? No, like, forget about credentials. You have all the incentive to stroke the patients, to give them the diagnosis they came in for. It's no skin off of your nose. You don't sit there with that individual patient and think, oh, well, in general, we're overdiagnosing. Especially not women. So you come in, and there's, in psychiatry and psychology, I'm just going to go ahead and say psychiatry, has a big problem with secondary gains, more than the other medical fields. Secondary, in German, you have an amazing word for this. It's called Krankheitsgewinn, like what you win from being sick. So there's a huge incentive structure around getting that diagnosis. So you get accommodation, you can use it as leverage in your environment to get what you want, to get people to comply. You get a lot of attention. You get a redemption arc, which is, if I'd only been diagnosed sooner, I could have done all these things. You get to bring it up whenever you want. It becomes a part of your identity, which also makes it untreatable. You cannot treat something someone has incorporated in their identity and is proud of.
Yeah. Yeah.
Right? It's like so there are
Yeah.
all these things, and you have the medication if that's what they're seeking.
Yeah.
Well,
and then
so you have all these things, and it becomes very difficult for the person. And I've seen experienced psychiatrists being unable to say no. And also, like, what is the training? Even the psychologists who have to do a PhD, who have to do all the training, what are they trained to do? I did a training, right? I did the 3-year training in cognitive behavioral therapy. Was I taught to properly distinguish between the diagnoses? Not really. Not really. I was told to validate. I was told to make the person feel comfortable. I was taught how to get them to comply to treatment, which basically just means how to make them come in week after week, how to discover resistance in therapy, and resolve that, how to make them feel comfortable. So I don't think anyone's really being taught to say, this is not that diagnosis, this is this diagnosis. And that's where we have a huge failure in differential diagnosis. That's what we're talking about here.
Right.
Doing proper differential diagnosis in psychiatry, that's not happening anymore, to the point where so many people are being diagnosed with both ADHD and autism, so that they're now talking about making it a combined diagnosis, or DHD. Because so many patients are exhibiting signs of both ADHD and autism at the same time. But hello, those two stand in opposition to each other. If you look at the traits, if you look at what they actually do, they're supposed to be oppositional. And until just now, we all acknowledged that those conditions stood in opposition to each other. But because of the dilution, because of the inability to do a proper differential diagnosis, we're just saying, yes, of course. And now you have this new term that we are going to call ADHD. So,
oh my gosh,
I talking about credentials, it's not going to matter at all.
No, that's a good point. No, I'm glad I brought that up to you then, because you're right. That hasn't helped us in the past at all. But wow, though, it's scary. Like, if I was a parent listening to this episode, and yeah, like, my child was going through puberty, and I mean, especially girls, like, grade 8, grade 9 or something like that, where it's a real struggle. And you want to bring that child to someone who can make an actual differential diagnosis, like you're saying, because I mean, these kids are sponges, like you say. Once you label them, it's hard to unlabel somebody. And in
you're
terms of
disabling them,
right,
you're disabling
right,
them for life.
yeah,
they carry that with them. You never hear anyone saying, oh, I used to have ADHD and now I don't anymore.
right.
No, what you hear is, I was the most ADHD my doctor had ever seen.
Oh yeah.
I was the most. Oh, they wondered how I could ever have made it through schooling. That's what you hear. And there's so much narcissism in that, right? Because we give status to victimhood.
Yeah.
And this is about, how can I become the best victim? I'm the best at being small.
Yeah. Yeah. And that's why I wasn't able to get into law. And that's why, I wasn't able to get that certain position.
Everything, right?
Yeah.
Redemption arc.
Yeah. 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 No, very true. And yeah, like, I was talking about kids, but like, your work is mainly identifying these women. And yeah, it's like, no wonder there's mainly women, like you say. I mean, because of the emotionality that women have as well. Like, it's sort of, like this disagreeableness and this heightened, awareness of their feelings, you could say, the depths of their feelings. And hell or high water, they're gonna, they're going to tell you, these are my feelings, and you can't argue with that. So like your channel is great in terms of showing examples of this. I love, like you say, people send you reels, right? And like, videos of these women having their little tantrums sort of thing. And um, actually, like I was just thinking, like, not that I watch a lot of US politics, but this whole thing with ICE and everything like that, I've seen these ICE people, they're mainly approaching women, and women like freaking out. Have you looked at any of those um video
Yeah, I
segments?
think we can put that in, the yes, of course.
Yeah,
These,
yeah,
as with the campus protests that have been going on now for years, and the No
yeah,
King protest, you see a very aggressive women,
yeah.
and they cloak that in, this is, I call it weaponized neuroticism.
Mm, mm-hmm,
That is what that is.
mm-hmm.
It's but they are so justified.
Yeah,
They're justified because they feel it so intensely. So that's this, I call that psychobabble, that
yeah,
because I have strong emotions, I'm allowed to be mean.
right.
And emotions justify
Yeah,
bad behavior.
yeah, yeah.
And you see that very clearly. They use their intense emotions, and they don't care about social norms, and they are justified
No,
because they are fighting for, everything. It's not just the eyes, they're fighting for climate, or they're fighting for,
yeah,
I don't know what. All these, they're justified in their intense emotionality.
right. Which
Um,
is why you
or
talk a lot about
if it's
the feminist movement as well. This is highly linked to, what we've seen with the feminist
the
movement.
feminism, absolutely.
Yeah, yeah,
Yeah, I think that feminism has a lot to answer for in the flourishing of the borderline and the narcissistic traits among women, because
mm-hmm,
we do nothing to tame our worst impulses,
yeah,
and we do with men. Right? We have no problem talking at length about what a good man is, what
mm-hmm,
good masculinity is.
mm,
We talk about almost nothing else, how to be a good man and how to be a good father. But I wrote an article on what is a good mother, and
yeah,
people freaked out. It was just, what you can't say, we can't begin to define what a good mother is or what a good woman is.
yeah,
And that is just, aren't we just feeding our worst impulses? I'm allowed to do however I want to live, is right. However I want to express my emotions is the right way. I shouldn't be asked to sacrifice for anyone. I should do whatever all of these things, that comes from feminism. They eradicated these
yeah,
social norms for
yeah,
women.
yeah. How dare you put me in a box, right? Like, how dare you, yeah, give me some structure and yeah,
Tell me what is one. You can't tell a woman that one thing is better than another. You can't tell her
no,
that it's better to be home with your kids while they're small
yeah,
than it is to go out to work. And you can do, yeah, but a lot, then you'll immediately hear, well, families need the money and the financial. Fine, but
mm,
can we at least agree that one thing is better than the other?
right,
We can't even do that because it puts limits to
mm-hmm.
how women can fulfill their every desire. And what is that if not, narcissistic whim?
Exactly. Neuroticism,
Yeah.
like you say, yeah. Like, so, give me example. Like, I know, like a lot of people are probably picturing, like you say, women in front of parliament buildings or whatever it might be on marches and things like that, or yeah, women that are being, harassed by ICE or whatever. But how about, like you mentioned in the beginning, workplace bullying? Like, that sounded kind of interesting. Where might we see that, like in the workforce? Like, what should women kind of look out for? Because you're right. Like, if you have a pursuer, like sort of in the withdrawer, in a workplace setting, like two women, one will definitely quickly dominate over the other. Like, because women can, oh my gosh, women can be so catty, right? Like I think it's sort of fueled a lot by envy as well. I find women are much more envious of other women than men are. Um,
Yeah, women are as aggressive as men.
yeah,
It's it's a misunderstanding that we think men are more aggressive. Just women will express aggression in a different way. We will be relationally aggressive, and use the language of the heart, and men will be more outwardly aggressive, right? That is the difference between the borderline and the antisocial male.
yeah,
And I mean, just think of the scars and the borderline personality disorders. They very frequently turn to self-harm. That's a hallmark of the disorder, self-harm. And that is, I mean, it's internalized, but it also signals the lengths I will go to if threatened. I'm capable of violence, starting with myself. So the scars very much signal the type of aggression they're capable of, and the visible scars are very able to control the environment around them because of this type of signaling. And that is what they will do. They'll seek to dominate the environment around them, to control via relational aggression. So threats, false accusations, gossip, innuendo, and that's what we do when we when women compete with each other.
yeah,
Right? We form little groups, and we talk about each other, and we show loyalty to the few people in the group.
yeah.
We immediately establish who's on top, and then we form around her, and the queen bee, and she sort of allows us to have just enough status that we will be loyal to her.
Yeah.
And there's a lot of there's a lot of borderline traits in there. I think we have to, right. So women are very aggressive, just in a very different way, because we're fragile. We're physically fragile. So the way we express aggression is through things that are hidden, cloaked, and we cloak it now in this emotional language. I am so broken. I am the most broken. That we do it in the name of something that's really compassionate. Yeah. Right? I'm pouring paint over this painting because I am so compassionate. I only think about the climate, so I'm going to ruin this $30 million painting. Right. Very aggressive, but you can still come across as compassionate, which for women is the most important thing. Like if you ask women why they cut it off with a girlfriend, for example, they'll always say like they weren't loyal or they weren't kind. Right. So for women, it's very important that we ask about their family, that we ask about their, it's very important that we seem kind. That is sort of the first thing that we'll say, no, she wasn't nice. Well, it is because we used to child rear in a group, right? We used to depend on each other for child rearing. So we would, if someone wasn't kind, that would be a direct threat to our children.
Okay, this goes back in tribal times. It makes sense.
Exactly. Yeah. So we're more agreeable because we are dependent on that group, because we're fragile. With men, and you see this with like football and stuff, they're very happy when one of the males is much better than the others, because it furthers the whole team. Yeah. They were hunting together, so if one was much better, great for the group. That's not the case with women.
No.
We don't like it when one is much prettier. Yeah. Because that's a threat.
Yeah. Yeah. And it's I can think of there's like it's done in two ways though. Like it's sort of like, woe is me, like them acting as such a victim. But then I've also seen it in a very, like you say, you mentioned it too, but like much more an aggressive way in terms of, let's say they're trying to, like I've been part of some online groups that they call it like coaching groups or whatever, like for
Mm-hmm.
empowerment coaching groups. This is something I want to explore with you a little bit further down the line as well. But it's sort of like they have a way of making it's much more cult-like. It's like you need me in order for you to be a more empowered person, a better person, yeah, stronger woman or whatever it is, you need to be part of this group because, we will show you. And that's bloody scary as well. Like, because it's like I say, women know how to play upon other women as well. Like they're very good sales. Like if you got a good saleswoman on your team, right? Like look out. Um, they they're very very good at manipulation as well. But yet, they want to call men like the biggest manipulators and narcissists as well. So, I like you're seeing it like in certain lights. I'm the way I see it in my room in the therapy room is women often calling men narcissistic because they feel like they've given everything in the marriage and the man has given nothing when really it's just sort of a distorted perception on each of your own suffering. I call it like it's sort of like they perceive that they're the only ones that have suffered in this relationship and they can't seem to understand that this man has also suffered greatly because of, I don't know, maybe your controlling ways, your helicopter type of parenting, all in the name again of compassionate care for their child, allowing the child to sleep with them almost every night, right? Volunteering at the school, aka controlling their child in the classroom as well, because you're an over anxious,
Mm-hmm.
woman or whatever it is. Like they've managed that family, they've scheduled that family, they have so many masculine traits in that way, and yet they want to break away from the marriage, after 15 years because he's so narcissistic because he all he does is work or something like that, or well, maybe he doesn't want to be home for a reason, like maybe everything he tries to do at home, he's told he's doing it wrong. Um, Obviously that's not all the cases, but I'm just saying like it's interesting that they're saying that, they're so caring and compassionate when really they can't seem to see their spouse's suffering. All they can see is their own suffering.
Right. I see a lot of feminism in that as well. That it
Hmm.
has taught us to completely overemphasize our own contributions in everything,
Yeah.
our own suffering and our own contribution, because feminism has taught us that everyone else is always to blame. So
Yeah.
that hinders the taking accountability, and that we are constantly oppressed no matter what you do. You can claim oppression. And who's oppressing us? Well, men.
Hmm.
It's so that has really, we're so hardwired to overemphasize our own contributions and our own suffering, and we're taught that men and women are just the same. So we don't understand anymore how men are affected by their emotions, how men express emotions, and what they need to process their emotions. So if they are not crying and expressing all of their worries all
Yeah.
the time, that means they're not worrying.
Yeah. Yeah. Which is so untrue. Like,
Yeah.
I know it's just to even think, like pause and think, men don't have emotions or men do not like to talk about their feelings. I mean, that's not what I see at all. Like if you get
No,
them,
I think that yeah, we are raised with the resentment born by feminism, and we enter our relationships with that resentment towards men in general. We just don't notice it. We don't recognize it, and I
yeah,
think that is why so many relationships fail. It's inevitable because resentment is the psychological killer.
yeah, it
It
sure
bears
is.
nothing good, and
Hmm.
we resent men, and we are very quick to blame them and find fault in them. And as soon as someone disagrees with us, we call it narcissism. Because if you disregard my feelings, you must be a narcissist.
Mm-hmm.
If you disagree, you must be a narcissist. Because that's what that is. It's not. It's just low agreeableness
Right.
and striving for status. And it's more likely you than him.
Yeah, that's interesting, the striving for status part, hey? Like, I mean, like, I could see how that would happen, how it would be common then in the workplace. I'll step over you and whatever I can in order to be, in a higher rank. But like, um, at status also in marriages, right? Because it's that whole idea of I'm as I contribute as much as you do, but it almost has to be tied into income rather than, you know, what I'm contributing to the family sort of thing, which is really sad because we all know, I mean, you've been there, you probably still are there much more than I am in terms of because you have younger children. It's sort of like the like a day at home with kids compared to a day in the office, like where you're getting a, whatever, like gratification in terms of people thanking you for your work or whatever that is, rewarding you for your work. You get coffee breaks, you get peace and quiet. You can actually do your work without being interrupted. It's no one's having a tantrum on the floor, like or spitting up their food or whatever. Like it's just, yeah, it's too bad that women don't value um you know that type of contribution that they have to their families if they do choose to stay at home with their kids. So
Yeah, but I think, whether you do or you don't, we enter marriage and we're immediately giving points on a chart, right? Because we're supposed to be like equal teammates and
yeah,
partners. And I
yeah,
don't I don't enjoy those terms when we're talking about a marriage. This is supposed to be your soulmate, and
yeah.
you want to think about the family as a unit, and we immediately start giving points and tit for tat,
Mm-hmm. You're right.
and that is because we are so hardwired to count our own contribution, to always know what we're contributing compared to the man.
Yeah. Yeah, yeah, there should never be like even that word compared. Like it's like it's both equal, just
Mhm.
different, and that's the whole thing about the two genders as well, right? Like, I mean, you're both equal in dignity. It's just different, in terms of what you bring to the table, sort of thing. And yeah, I mean, so I guess if people want to, because I know I have to let you go here, but if people want to, and you're very prevalent on Substack, YouTube, um, but it's sort of like what you're trying, like your whole mission is what before I sign off
Public
with you.
health.
Sorry?
Public health. Public health. I feel I'm on a mission of public health awareness. And you would be astonished how many psychiatrists and clinicians are writing in and saying, like, please keep going. We cannot, we're behind you.
Yeah,
We can't say these things, right? Because
yeah,
I have the luxury of not fearing getting fired.
right.
If I was employed in a hospital, in a clinic, I could not be saying these things. But you'd really be, I was just talking to a researcher at Yale who's like, this is, this is accurate. This is what's going on. And so I'm trying to describe what we are all seeing in the streets around us in our relationships, how this affects men. And, if you want to help women, you have to make the situation more bearable for men. We don't exist without one another. There's no future. And so I do think that we have to sort of save women from themselves, save them from their worst impulses, and stop encouraging these traits. So that's what I'm thinking. I'm raising awareness, saying things that the system just won't let us express.
You're right. Yeah. And it's so important that this is so timely, like I say, because of now we're diluting even the regulatory bodies and like in terms of, the amount of, let's say, clinical psychologists that can make, really good differential diagnoses. But that's at one level. And then, the other level is sort of like ground up too. It's, for just to get the awareness out there for parents, for
men,
any individual. Yeah.
They have a lot of men writing to me who are in divorce and custody battles and awful. And they're like, they because of these personalities, they leave a trail of victims that nobody's talking about.
Oh
nobody's showing compassion for.
Yeah.
And so this work is also largely for them, that they get to say, that is exactly what happened to me, and someone gets it, someone's naming it.
Yeah. No, it's I can think of quite a few couples that, I wasn't able to save because of what you're talking about here. It's like you can only fight so much, and you can't fight with this cultural shift that we're all experiencing.
Exactly. Yeah, and ultimately it's for our children.
Exactly.
Because the result, what we're seeing is that men are leaving the institution of marriage altogether. Men and women aren't finding each other anymore. They're not happy with each other no matter what we do. And that hurts children. That hurts the future of humanity, because who's going to have all the kids that we need to be having? Right? Who's going to take care of them? So we need to I think I'm going to go out on a limb and say we need to help women again be worthy of all that men have to offer.
Exactly.
And I don't see that they are right now, and that's why men are just choosing not to engage. What's in it for them?
No, it's so to their psyche. It's just such a hit, it's sort of, I think and most of them get it out of left field too. Like they don't even see it coming, and all of a sudden one day, their wife is saying, I'm not happy. I want to leave. And, So, okay. I guess I know I need to let you go. I would love to talk to you more, but I don't want to make, so, we have to, I think the real message I want to leave my listeners with is sort of like that, because this is what I see every day, like that not every struggle is a diagnosis. Okay? Not every struggle that you see your spouse going through is like a diagnosis for them. It's, you don't need to tell them, you need to go see whatever, a psychologist or whatever. Maybe you guys just need to sit down and have a really honest discussion about what the struggles that you're both feeling right now. And then I think for you is like your main message is that this diagnosis that you've received at some point doesn't define you as a person. And like you say, public health in that sense.
Mm-hmm.
Okay.
Yeah, that's important. Mm-hmm. So you'll find me on Psychobabble on Substack or Psychobabble on YouTube. And that's the
That's
public
what you
health
are.
campaign.
Yeah. Okay. Well, we are all rooting for you for sure. So, okay, everyone.
Thank you
I
so
hope.
much.
Yes, thanks for coming on again. It was great. We'll continue this again another time. Okay. Bye-bye.
Thank you so much.
Thanks for tuning in to this episode. Remember that you can watch the full episode on YouTube, where I plan to hang out the most. Your feedback and suggestions for future guests are incredibly valuable to me, so please don't hesitate to post a comment. You are an integral part of this journey.